I'm going to start off. Case one is I remember my triage nurse coming up to me with this young 23-year-old who didn't look so good. He was hypertensive. His SATs were a little bit low. He'd been reporting headaches for about 6 months, was taking Tylenol every day for that. He was a little short of breath, and he kind of registered for headaches and flu-like symptoms. He looked a little anxious. He had a little dried blood in his left nostril. He was using accessory muscles. I didn't hear any rales or wheezing. With the ultrasound probe, or probes, actually, I used several things. I just kind of ran through a quick assessment of him as soon as he arrived. I just want to have you try to piece the case out here. So here's his first clip looking at the right upper quadrant sonogram. Anything jump out at you? What do you think of that kidney? You got a quick bead on the fact that this is not a normal kidney. This is pretty advanced kidney disease at this point. Again, this is a unfortunate 23-year-old kid. So you see the liver, you see the outline of the kidney. The contour is okay, but there's no delineation between cortex and the medullary component of the kidney, and the whole thing is really quite echogenic. You want to see renal cortex that's hypoechoic relative to the adjacent liver or spleen. So that's kind of your first clue. This bedside echo. There are a couple of little things that pop out here, and you can see this left ventricle is actually pretty thick. Okay, and a lot of patients, I will just do a quick assessment on, and if I see a really thickened LV, I know this is kind of a chronic issue, and I'll start them on some antihypertensive and kind of plug them in for outpatient follow-up to make sure that that gets managed better. Here's his lung ultrasound. So again, you got a nice, horizontal pleural line in the near field, and emanating from that surface, you got this little laser light show, okay? And remember, B lines come in different flavors. B lines that are from heart failure, are often kind of crazy laser light show. B lines from infection and COVID tend to be a little bit more rigid and fixed and glide back and forth with the pleura. And he'd also been complaining of some blurry vision. So I don't know if you've done any eyeballs while you're here so far, but you take the linear array probe, put it on the eyes, it looks like a little bladder, and you just kind of assess it, and you can see the optic nerve in the far field here and the optic nerve sheath. But this is kind of what I'm pointing at right here. So sitting on his retina is this little raised layer of as you would expect is basically blood. This is basically the retinal layer. That's the choroid layer. This is the sclera. There really shouldn't be anything, sitting on top of that. Talk about optic nerve sheath another time. You can see the anterior chamber, the iris here, and the back of the lens. So for blunt trauma, it's a good way for diagnosing if somebody has a lens dislocation as well. Essentially, in short order, you can kind of put this case together. And it's probably severe chronic hypertension, unrecognized, untreated, that led to his renal failure, his LVH. And he presents in pulmonary edema, and then has these retinal hemorrhages that are related to his hypertension as well.